Hi, I'm Dr. Geetha Appachu, Chief Head of Swapreran. Swapreran has a clinic in Bangalore, and if the question is, what do we do in a clinic? So, the first and foremost thing is that who would want to book an appointment to come to a clinic? So, there are questions whenever someone is calling saying that, do you deal with personal problems? Do you deal with problems that I have at workplace? So I have problems related to relationship, I have adjustment problems. And then several parents who call to ask that, this is for my child. A child could be just about 6 years, 7 years old, having issues at school or different behavioral problems at home. So there can be so many such questions that I get almost every day. Yes, to start with, do come whenever there are problems in all these areas that I was talking about, or the questions that has come up during all these phone calls asking for an appointment. So it is necessary, the sooner the better is a better way of explaining. It is necessary that clients should book an appointment whenever they feel that they have been finding it very uncomfortable, continuously having the same thoughts and the same problems. The first and foremost thing is coming to the clinic will require one to spend probably more than an hour. Most often I have had clients who could even take 2 or 3 hours to just vent out. Ventilation here is where one talks about the entire problem through the years and the way they have experienced it. Listening is just about the start of therapy. But in this one session, after the client has ventilated, it does not mean that they have actually done and they have cleared their symptoms. So when we are not indulging in medication, psychotherapy begins with ventilation, yes, but then there is a process and we progress with this process through sessions. So just one session will not at all bring about the desired changes. So we are looking at a reframe in this particular thought pattern and behavior process of the client. So we sometimes want the whole family to come and work together. With each individual client, the process is very unique and exclusive for the client. So there is no one kind of program or module that fits everyone. So this is so special for each client. This is so unique for each client. And this is made for a client. And this is how we work in a clinic. From the time that this whole clinic started, I've always understood that during my doctoral research, when I could use this with clients who were basically having issues of ulcers. So ulcers were found during an endoscopy, and doctors were already giving them medications. Why was it that they would feel some kind of relief, but the ulcers were completely not healing? Here, definitely, there was a beautiful intervention, believing that there is the psychological aspect of this illness too. This was the first step that we started working with this module, and therapy modules can be used not just for people having all these adjustment problems or relationship problems or personal problems, professional problems, or even problems for students with their academic issues or any kind of adjustment problems at school. This can also be used. What I'm talking about is psychological counseling can be used even for people who are actually going through a physiological discomfort, a physiological illness. Yes, there, along with the intervention of medicine, working with a psychologist can bring about the desired effect of understanding how they are feeling the wellness from within. And this is exactly what should bring clients to visit a psychologist. Thank you for listening.